Hi, and welcome to One Life, your visit with me, Dr. Trey Ahia. This visit, we will explore individuals that tend to be argumentative. They tend to be non-compliant. They tend to be defiant. Perhaps some of you have children that are 5 years old, 3 years old, 10, 11, and they may have some of those characteristics. Children with oppositional defiant behaviors. That is what we are going to explore this visit. So if you're wondering how to deal with them, or does my child actually have oppositional defiant behaviors, we're going to explore that and find out. So stick around and we'll be right back. Thank you for joining me, everyone. Today, we get to look at young individuals that are experiencing oppositional defiant disorder characteristics. What is this? Well, according to the Diagnostic and Statistical Manual, it's a pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness. And usually we find that it lasts at least 6 months and is evidenced by at least 4 symptoms from any of the following 3 categories. And I mentioned those earlier. They are angry, irritable mood, argumentative, defiant behavior, and vindictiveness. Parents and caregivers frequently ask, well, how would I know if my child has oppositional defiant disorder? Usually it appears during preschool years and rarely later than early adolescence. So oppositional defiant disorder often precedes the development of conduct disorder, especially for those with childhood onset type of conduct disorder. Oppositional defiant disorder is pretty serious, and its urgency is that it leads to problems such as poor school performance and work performance, antisocial behavior. And you know, people who have antisocial behavior are like those Ted Bundys and the Jeffrey Dahmers, and we don't want that for our children. Children that have impulse control problems, substance use disorders, certainly we want to avoid those types of issues. And then, of course, suicide. Research shows that many children with oppositional defiant disorder have structures in their brains that are not fully developed. As a result, these children are unable to read social cues. A child's ability to read their peers' social cues is extremely important in their interaction. Children who do not have the ability to do that may appear uncooperative, defiant, and hostile toward one another, even authority figures. And so this can seriously interfere with the child's day-to-day functioning. Some of the risk and prognostic features include temperamental, environmental, and my favorite, genetic and physiological features. In the temperamental category, these factors related to problems in emotional regulation result from high levels of emotional reactivity, poor frustration tolerance, children that have outbursts when they're very young, and they break down in stores, cry, fall out on the floor, start to kick. These have been predictive elements of children who later grow on to exhibit oppositional defiant disorder. Environment also plays a role. Harsh, inconsistent, or neglectful child rearing practices are common in families of children and adolescents with oppositional defiant disorder behaviors. And these parenting practices play an important role in many casual theories of the disorder. Yeah, I hear you. You're already saying it comes back to the parents? Absolutely. In most cases, it's a result of types of parenting styles. So we certainly need to be cognizant of that as well. The genetic and physiological features that are relevant are there are a number of neurobiological markers like lower heart rate and skin conductance reactivity, reduced basal cortisol reactivity, abnormalities in the prefrontal cortex and the amygdala. And you know that the prefrontal cortex, that portion of our brain, helps with our executive functioning features of an individual. The vast majority of studies have not separated children with oppositional defiant disorder from those with conduct disorder. So there's still some research that needs to be conducted, certainly to support children who have this disorder. Cornerstones of treatment for ODD usually include parent training, parent-child interaction therapy, we call that PCIT, individual and family therapy, cognitive problem-solving training, social skills training. There are things you can actually do to manage the child's behavior, like giving clear instructions and following through. I cannot talk about that enough, to follow through, be consistent, and recognize and praise children for all of those positive behaviors and positive characteristics to promote the desired behavior. Can you prevent oppositional defiant disorder? Well, there's no guaranteed way to prevent this disorder. However, through positive parenting and early treatment, you can at least help improve behavior and prevent the situation from getting any worse. So the earlier ODD can be managed, the better. You have to be consistent in how you treat children who experience this. Remember, their self-esteem can sometimes be challenged. We want to rebuild those positive relationships between the caregivers and the child and peers around them. And if you're still not certain how to support your child through these troubling times, call me, email me, subscribe to my YouTube channel, and some of your answers will be found here. Or you can even join some of my virtual workshops. In any event, all is not lost. Focus on making certain that you're doing all you can do to make your little one the best they can be. Wow, this visit has come to an end. I hope that you are able to get some information about children who display oppositional defiant disorder characteristics. Remember, your persistence beats out their resistance every single time. So be persistent in what you have incorporated to help reduce some of the characteristics that you see your children displaying. Get that structure in place. That's important for these young folks. Seek the support of someone who's familiar with this disorder, a clinician, a social worker, a therapist. Get as much information possible that will help you to help them. At times, as parents, you think that all of the things that you are doing to keep your child safe, to help them get to adulthood, is all in vain. But you can be certain that through the maturation process, at some point, your child has the ability to reflect back on the training that you have incorporated in them. And as they mature, remember that you have done the best that you can do, given what you have been given. So try not to worry about it. Reflect back on your own life. And remember that you only get one life. So live your life to the fullest. Until our next visit, be well. This visit of One Life was sponsored by Soon Photography, the media that gets you noticed. Music for this visit was brought to you by DJ Chill X.